Sorry, I had to pause. I forgot we have to record this. So we're recording. That's housekeeping item number 1. Just so you know, we are recording this webinar, and we'll be posting the slides and the link to the video recording after the webinar is finished today. These webinars are designed to relate back to our 6 HealthLinks benchmarks, which comprise of our HealthLinks standard. And we're aiming to provide you and your team with resources to help you create a supportive and healthy work environment for your employees. Today we're going to be focusing on evaluation, which is a crucial component to sustainable and effective cultures of total worker health at your organization. In today's webinar, you will learn about the role and purpose for evaluation, theories behind evaluation, and practical application strategies. So before I get into introducing our speaker today, I did want to just remind you of the HealthLinks benchmarks that you can see here. And then today we'll be focusing, as I mentioned, on this 6th benchmark, evaluation. Few housekeeping items. Everybody will be kept on mute throughout the duration of the presentation. And if you do have a question, feel free to use the chat box, which is in the control panel on your screen. And I'll monitor the questions and coordinate with Carol on answering and getting to those in a timely fashion. As I mentioned, this is being recorded, so we'll go ahead and share the link and a copy of the slides in our follow-up email. And after this presentation, there is a survey that will pop up. Please take 2 minutes to answer the short questions and let us know what you'd love to see in the future. We're trying to map out our 2019 schedule, and we'd love to hear your ideas on what you're looking for. All right, so today we have one of my colleagues, Dr. Carol Brown, and she is responsible for directing all research activities for the Center for Health, Work, and Environment, including project management and coordination of our grant submissions. Carol has over 12 years of experience in program evaluation and leads the program evaluation activities for the center, including the Mountain and Plains Education and Research Center, where she works with faculty and staff to develop and use evaluation metrics to improve programs. Carol also directs the Pilot Projects program for the MAP ERC, and she has her PhD in psychology from the University of Southern California. And when Carol is not working, she enjoys being outside and chasing after small children. All right, well, thank you for being here. I am going to hand over control to you and let you get started. One second while I get going. Okay, great. Thanks everybody for joining. It's great to have you here today. So as Kaylee said, I'm going to be talking today about practical program evaluation. Kaylee touched on this a little bit. She's stealing my introduction thunder, but we are with the Center for Health, Work, and Environment. It's one of 6 centers of excellence for total worker health, and it also houses the Mountain and Plains Education and Research Center, which is one of 18 centers of its kind, and they're both supported by the National Institute for Occupational Safety and Health. And so a little bit about me. I got into the program evaluation field while I was completing my PhD in psychology at USC. Since 2009, I've been directing evaluation activities for a number of different programs, including the Colorado School of Public Health, other grant-funded public health programs, such as a colorectal cancer screening program, a tobacco technical assistance program, and currently I am the Deputy Director for the Center for Health, Work, and Environment, where I still lead evaluation activities, mostly for our NIOSH-funded center grants, as well as other programs, including HealthLinks. So for today, we're going to discuss evaluation and how you can effectively evaluate your workplace health and safety programs. We're going to touch a little bit on the theory behind evaluation, but really try and keep it at a practical level so you can get useful information to take back to your workplaces. And some of these practical evaluation tools we'll discuss will include SMART goal setting and logic models. So just briefly, to make sure everybody's on the same page, when we talk about evaluating total worker health programs, I want to make sure everybody knows what total worker health is.
So total worker health is defined as policies, programs, and practices that integrate protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts to advance worker well-being. So it's really getting at your health, safety, and well-being initiatives at your workplace. And what is evaluation? So evaluation is the process of aligning organizational mission and vision, program goals, assessment data, and program activities in a systematic way that allows for informed decision-making and progress over time. So in other words, evaluation is really looking at program results and determining to the extent possible whether the program you put into place is responsible for those results. So backing up just for a minute, a program is a set of resources and activities directed towards one or more common goals. So a program could be very limited, it could be a limited set of activities, it could be a single activity in one work site, or it could be a complex set of activities that span many sites and many levels of an organization. And so consequently, your evaluation could range from a very simple evaluation to much more complex. So in simple terms, we conduct program evaluations because we want to know whether something works, and we want more than anecdotal evidence to support our assertion. And so program evaluation really attempts to provide processes that you can use to obtain better and more valid feedback in your organization. Today, we're going to talk about the framework for program evaluation in public health, which was developed by the CDC, and this is the theory, the framework I'm using through the course of the rest of this presentation. It was designed to be an approach that's practical, ongoing, and integrated into routine program operations. And as you can see, there's 6 steps to the framework, starting with engage stakeholders, describe the program, focus the evaluation design, gather credible evidence, justify conclusions, and ensure use. And we'll touch on each of these in a little bit more detail. Starting with engage stakeholders. So stakeholders are really the persons or organizations who have an investment in what will be learned from an evaluation. So when you're developing and implementing a workplace health and safety program, you could think of some of your stakeholders, and they might include the leadership of your organization, the employees in your organization, it could be outside vendors, it could be insurance companies, it could be a whole host of people who are interested in what you're putting into place and the results of those programs. One important subset of stakeholders to focus on is whoever will be the primary user of the evaluation results. These are the specific people who are in a position to do or decide something about your program. And the reason for involving those people early in the process is later on when you're trying to get them to use your evaluation results, if they've had a hand in the process and understanding of what you're doing, they're much more likely to accept your results, whether good or bad, whether they agree with them or not. And other reasons for involving stakeholders is to help increase the chance that the evaluation will be useful, it'll improve its credibility, and even though engaging stakeholders is presented at the beginning of this framework, it's really an ongoing process, and you'll see as we go through the framework how engaging stakeholders really comes in at all points in the evaluation process. The second step of the framework is describe the program. So by describing the program, you're really setting a frame of reference for all the subsequent decisions you make. For example, if you have a goal to reduce hearing loss in workers, you can go about this in several different ways. It could be that your program is developing a hearing protection policy or implementing a program. It could be training workers on how to properly use personal protective equipment. It could be to actually reduce the levels of noise in the workplace. And so in order to properly evaluate something, you have to describe what your program is. And this development of your program is likely based on several factors, such as the needs of your workforce, available resources, and other workplace contexts. And like I said, the stakeholder involvement will really help benefit this as you're describing the program and setting up the evaluation. The next step in the framework is to focus the evaluation design. So with unlimited time and resources, you could really develop a very sophisticated evaluation plan. However, most people don't have unlimited time and resources, and oftentimes evaluation is sort of an afterthought. But if you focus your plan and collect data that will be useful, you can use it to influence decisions about your program. Part of this process of focusing the evaluation design is to prioritize questions. And this is a chance to identify whether there are existing tools you can use if you're developing your own, In the case of a hearing protection program, focusing your evaluation would be to determine whether you want to measure, say, the number of hours of exposure people have or the decibels of noise that people have. However, if those aren't factors that you can change, it might be better to design your program and focus the evaluation design on perhaps the effectiveness of training workers to wear personal protective equipment. And the next step in this framework is to gather credible evidence. So data that's deemed credible is much more likely to be accepted by the end users of the evaluation. And so there's 5 areas of credible evidence that are outlined in this framework. The first being indicators that can be interpreted. If you're collecting data and you don't really have a frame of reference for what to do with it, if you don't know whether it's good or bad or neutral, it's not going to help you very much to make decisions about your program. Data that comes from trusted sources, such as HR data or data that comes from multiple sources, is more likely to be credible. So this could perhaps be taking HR data and combining it with survey results from your employees. And so when possible, objective data is deemed to be more credible than subjective data. So for instance, if you're developing a lunchtime walking program to increase physical activity, you can ask people how satisfied they are, but you also might want to pair it with something about participation. Are people showing up and participating in the program as well? Perhaps how many people return week after week, and you might have objective health data, and you can take data from those multiple sources, some of it objective, some subjective. The next thing to consider is the quality and quantity of your data. You have to really consider the amount of evidence you need to collect to make an informed decision. Assuming that it's of high quality, more data is better, and it allows for more confidence in your decision-making process. However, you really want to think about how it will be used and avoid collecting too much data. You don't want to ever just collect data for the sake of collecting it if you don't have a plan to use it in your decision-making process. And then finally, logistical aspects, such as the timing of when you'll collect data. There may be times of the day or times of the year where it makes more sense to collect data about your program. So just thinking through what some of those factors might be that would influence that. Another part of the logistical considerations is who you will sample, whether that's all employees in your organization or a subset. Some of that may depend on size of your organization. Employees, like the rest of us, tend to get survey fatigue. And so there are some ways to combat this as far as considering how you can have fewer data collection points while still getting what you need. So you could do this in ways such as assessing the needs and interests of programs that you have currently implemented or are considering implementing. But if they've already been rolled out, you can consider also collecting satisfaction information and participation and other things all into one survey instead of multiple survey points. The next step in this framework is to justify your conclusions. And this occurs through analyzing your results, combining data sources if necessary, and then interpreting those results. And this interpretation includes determining whether there's a practical significance to what you've learned. When I say combining data sources, sometimes data sets can't be linked directly, but you can use both as part of your body of evidence. For instance, you might be able to link participation in your program to individual health risk assessment, and that may only happen in a perfect world. However, you might have the health risk assessment data, and you might have participation data, and you can see whether it's high or low, and you can look at both of those. And that's where it comes into, it may mean reporting both of them separately. So it may be saying that 80% of your employees participate in 2 or more health activities, and perhaps there's a 4% decrease in BMI at your most recent HRE screening. You can't necessarily say that one led to the other, but by reporting both sources of information, you're having more data sources to help support your evidence and justify your conclusions. You then have to use that data to make judgments about the merits of your program. So going back just a minute to our noise example, it may be that a company isolated noisy equipment to one part of the warehouse where employees worked. So the people using that machinery ended up having a much higher exposure to the noise, while the greater number of people had reduced exposures. And so when you're justifying your conclusions, you're deciding whether or not this trade-off is worthy. And then finally, recommendations for continuing, expanding, redesigning, or ending a program can be separate from judgments about its effectiveness. It's possible that a program may be successful, but other competing priorities may still lead to a recommendation that it be discontinued. And the final step in the CDC evaluation framework is to ensure use. If you do all of this work and collect all of this data and you sort through it and you come up with some recommendations, you really want to make sure that they're being used appropriately. So this is where taking into account the end users will help you design perhaps reports that could be more or less formal depending on your audience, to provide evidence and recommendations in a timely manner. There's also a process of follow-up where you have to come back to people and make sure that they're using the results and they're not just disregarding them if they don't agree with what they wanted them to be. And this really circles back again to involving your stakeholders. To the extent that you have buy-in throughout the process, there'll be greater acceptance of the results, whether positive or negative. So shifting away just a little bit from the CDC framework, we're going to talk about some evaluation tools and how they play into designing an evaluation based on the framework. So today we're going to discuss SMART goals and logic models. SMART goals is probably the more common one that people have heard of. So SMART goal setting is a method that allows you to develop goals that can be evaluated easily. They're specific, measurable, achievable, relevant, and time-based. And by creating goals with this level of detail, you're really helping to define your program and your criteria for success. So as you can see here, SMART goals are specific, and that includes the who, what, when, where of what you're doing, what your program is. They're measurable, so there's a way to determine whether or not you're making progress and achieving success. They're achievable, and so while it's good to have reach goals, it's also important to set goals that are realistic so that they can be achieved. They are relevant and worthwhile, and finally, they're time-based, so you have a target date for implementing and reaching your deliverables. So less commonly, you'll see smarter goals, and this is the same. It just adds in a process to add in, evaluate, and revise. So we'll go through an example, and you'll see that not all goals are going to have every aspect of the SMART goal characteristics, but to the extent that you can implement more detail and specificity into your goals, it's going to be easier to evaluate whether or not you've successfully met them. So just walking through, excuse me, walking through an example, you might start with a goal that says, increase physical activity among employees. So this has the what and the who, and what you want to do is think through and reword how you can include the how. So you might revise that to have increased physical activity among employees by creating a walking club. So now that you've got the who, what, and how, you have to consider how you can measure this. So it might be that you want to increase physical activity among employees by creating a walking club that 50% of employees participate in. So this is getting to your achievable. It may be your ultimate goal that you want to have 100% of employees participating in your walking club, but if it's a new program, 50% may be a more realistic target. And so then you have to decide what your time frame is. And so your goal ends up being to increase physical activity among employees by creating a walking club that 50% of employees participate in by the end of the year. And when we get to the end of my presentation and the references, I have a link to a SMART goal worksheet that helps you outline and create SMART goals. And finally, I'm going to shift into logic models. So logic models are a picture of how your program works. It includes resources and activities, which is really here, it's labeled your planned work before we refer to it as your program, but it's what you're doing and how you're doing it. And then you have your intended results, which include your short, medium, and long-term outcomes. So in just a minute, we'll walk through a simple logic model and see how it relates back to the steps outlined in the CDC evaluation framework. So the evaluation component of the logic model is really this intended results, which includes here labeled short, medium, and long-term outcomes. It's really your outputs which are the direct products of your program activities. Your medium term or your outcomes are changes in behavior, knowledge, and skills. And impact is the change that's occurring in your organization or your community more broadly, and often in here referred to as long-term outcomes. So just looking here at a pretty basic logic model, you can see you have the planned work, which includes your resources and activities. So resources are things like, do you have a worksite wellness coordinator? Do you have a budget to implement something into a program into your workplace? Do you have buy-in of leadership? The employees themselves are a resource. So before I get too far, the associated goal, which isn't listed on the screen, but the associated goal for this logic model is our businesses will improve employee health by implementing new policies by October 1st that help employees build 30 minutes of physical activity into their workday at least 3 times per week through flexible scheduling and changing meeting structure. So you can see how when you make a SMART goal, it gets a little bit wordy to get all of that information in there. But then here you can see, related to that, it's easy to plan those activities. How can you help employees build 30 minutes of physical activity into their workday? What activities do you need to develop? And here it's walking meetings, allowing flex time to build in physical activities. They've created a way for employees to log activities and then also reward participation. And so then going on to the intended results, you can see short term, you want to increase levels of physical activity. And that could be measured in a variety of ways. That's perhaps looking at how many people are participating in your walking meetings and taking advantage of the flex time. Looking at the employees who log their activities, you're getting their self-report measures of their activities. In the medium term, you want people to report that they feel better, that their well-being has improved. Perhaps because of this policy, they've increased their satisfaction with their employer and decreased their absenteeism. And finally, the longer term would be objective measures of employee health. And those take a while to get to, but at the next HRA or the one after that are the measures of health that you're interested in. Have they improved? Have you improved employee retention? And so some of these are objective, some are subjective. Some of them seem to relate more directly to the health and the increased physical activity of the employees, where others are things that are probably more of interest to management. And this is where if you're involving leadership or management perhaps in the design of your program and the design of your evaluation, while you may be interested in, are we getting people to move more and are they healthier, management might also want to know, oh, if we're implementing this policy and providing this additional flex time, are we seeing other perhaps non-health related outcomes such as the decreased absenteeism or improved retention. So tying it all together, the process of developing a logic model is one where you can involve stakeholders, use a collaborative process to develop your logic model, and this tends to be the most successful. So when I've developed logic models in the past, it's often been most successful when I've sat down with a group of 3 to 5 people and we've bounced ideas off of each other. Typically, I'll start with the long-term impacts. I'll go back and I'll say, well, what do I ultimately want to achieve? I want my employees to be healthier and I want to improve employee retention in this case. And then you think backwards about what you need to implement to make that happen. What activities do you need and what resources would you need to get to your proposed outcome? Once you've created your program and your logic model, you need to periodically revisit it. If you collect data on a semi-annual basis, you can review the logic model at the same time. You're justifying your conclusions and ensuring use. It's part of the process, and in fact, the logic model can be brought in when you're creating your reports, when you're showing people the data you've collected. You're saying, well, we did X, Y, and Z. We expected these outcomes. Here are our outcomes. So it can also help people visualize the steps in your process. And then it's also important to look at your logic model and try and figure out if you're not meeting the goals that you've set, what might be going wrong. You might look at the data you've collected based on your logic model and realize that no one took advantage of the walking meetings and that you didn't see an increase in physical activity. Or you might see that everybody took part in these meetings and increased their physical activity, but you didn't see the long-term outcomes and the improved retention or the better health outcomes. So starting to identify what worked, what people did, and maybe what outcomes you didn't achieve will help you go back and look at this and figure out what steps you can take. So thinking for just a moment, if you can think about a small business that has 25 employees that's recently implemented a new worksite wellness program, but they didn't consider or implement an evaluation plan. Can you think about some of the ways in which their new program may have been strengthened with an evaluation plan? Some of the problems that they may have faced were that the employee needs weren't determined, so they designed a program without employee input, so they didn't know what employees wanted and they weren't interested in what was actually implemented. It could be that without thinking through the evaluation plan, they didn't make any effort to collect baseline data or determine if the data sources actually existed. So after they implemented the program, they could see that people participated in it, but they had no way of knowing if it resulted in any of the outcomes that they were interested in. So it's just important to think through the evaluation plan in the beginning as you're designing your health and safety programs. And so just some questions to think about as you're thinking through your evaluation plans for your programs. What data sources do you already have? I mean, the easiest thing to do is not to have to go out and collect more data. So if you have access to HRA data or health insurance data, or your organization does other types of surveys already, are those things that you can tap into. The next is, what is the process for using the evaluation data? And somewhat relatedly, who's involved in collecting and analyzing the evaluation data? So this might be part of the health and safety committee. This may need involvement from HR or from your health insurer, your workers' compensation insurer. So thinking through how you're going to use the data that you do have and how you're going to collect and analyze it in the beginning is great. You have to think about whether or not your data sources only address process measures, in other words, participation, or if you're measuring outcomes too. So like I said a moment ago, if you're collecting data and you know whether people participated in a program or not, but you don't have any longer term outcome data, you're not going to know if it actually improved health outcomes, or if it improved retention, or the things that you and your management may be interested in. And finally, just thinking through what new information you would like to collect. So that may be new information that you want to collect for existing programs. Maybe you get your data back and you're still not quite sure how to answer your questions or make recommendations. So what other information would help you make that decision? Or if you're implementing new programs, the same thing. What information would you like to be able to collect to be able to answer the questions? So some of the key takeaways here, for me, evaluation is a key step and should be considered in conjunction with stakeholder engagement in the program design. It often works best for me in my years of experience when people come to me at the very beginning of designing their program, where there's still time to make changes to the program based on the evaluation. It's important to set annual or biannual check-ins to examine evaluation data and make programmatic decisions. And those don't have to be set in stone. It may be that you implement a program that's only a 3-month program, and so you have a different time frame. So it's really dependent on your program and what you're trying to do. But it's just important to set those check-ins, especially for ongoing programs, to make sure that things are still working the way you want them to. Developing SMART goals will help you create actionable and measurable goals. And finally, logic models really help catalog the program activities and tie it all together. And people who aren't necessarily involved in your programs and your evaluation activities find them fairly easy to understand and see what you're trying to do. So I mentioned earlier, I have some links in here for some resources for you. The first couple are for the CDC framework for evaluation. The first one is an overly long evaluation document that you probably aren't going to read unless you're really into evaluation. But the second link there gives you a shorter overview with a little bit more detail of what I went into today. The SMART goals, the link there is to a worksheet that provides more information on creating SMART goals, and also gives you a worksheet for starting and answering the questions for each of the categories to make sure that your goals are SMART. And finally, the last reference resource there is for a logic model development guide. It walks through the process pretty nicely from simple to much more complex logic models and gives you the information you need to create those. And with that, that's the information I have today, and I'm happy to take any questions that may have come up.
Yes, thank you. Please feel free to type in questions. We prefer you to just type them in so that not everyone speaks at once. I'm sure you're all itching to ask questions. I actually wanted to ask one to start it off. Do you feel like it's best to have your logic model for each maybe initiative, so a walking program, safety program versus everything that you know you're going to be doing for safety and health, or both?
I think it depends a little bit. It may make sense to have one for safety initiatives and one for health initiatives, particularly if they have common outcomes. So if you have common outcomes and maybe 6 different health-related activities that you think will lead to those common outcomes, that may make sense. Okay. That being said, I've also created some really complex ones where it would be, here's my integrated health and safety program. My outcomes are ultimately that workers will be healthier and safer, and you can build it all in together. You can design it where there's a series of smaller boxes versus the large column. So there's ways to do it. It's a little bit of what makes sense. And then that logic model guide that I shared the resource to gives a lot of examples for different ways that you can set it up from like pretty simple to more complex. Especially in the beginning, it may make sense for people who are just getting their feet wet with developing them to work on sort of one initiative at a time. Yeah, and it might make more sense to think through it that way.
That makes sense. Thank you. I do see a question just asking if we'll be able to share the PowerPoint, and we definitely will. It'll go out in an email shortly after the end of this, and it'll have the slides attached with a link that you can download and a copy of the recording as well. Are there any other questions? Well, while you type away, I'll move on. If perhaps
I need to stop sharing,
or just if you want to click forward, I'm just going to talk through the upcoming events that we have. So we have these webinars every other week. So our next one is in 2 weeks. It's on cancer supportive workplaces, the different strategies around that. What is the research telling us right now? How can you start to be a cancer supportive workplace? Meaning, how can you support your employees if they have been diagnosed or coming back from treatment, all stages of that aspect. And our center director, Dr. Lee Newman, is going to be presenting on that. There is a live event that I wanted to flag for those folks in Colorado joining us. It's WestOn. This is an annual conference that happens, and it's a place where professionals gather with occupational health and safety professionals, epidemiologists, local public health, and health department reps, all in the same place, sharing ideas, strategies, and really talking about occupational health and safety. It's in downtown Denver at the Curtis Hotel, and it is free. So if you'd like to attend that, I've included the link here that you can click on when the slides go out. I have a question that just popped up. So Carol, are there examples of surveys for employees? I'm thinking more healthy meals opposed to walking, but I should do a survey to see what my employees would want.
Yeah, I don't know specific ones to recommend for that, but I have to imagine there's a host of things, and Google's your friend in this case.
Yeah, and I'll chime in that on our healthlinks.certified.org website. If you go to our resource center, we do have sample surveys. We have one that we've branded as ours, an employee interest survey, and then there's a couple other examples that you can kind of pull from all of them and create your own, or just use the questions directly off of that.
Exactly. That was going to be my other recommendation. No, perfect. If you find a survey that mostly looks good, but some questions don't apply, or there may be additional things that you want to add in, but there's just so many available resources, it doesn't make sense for everybody to just start from the beginning and create their own.
We also have a few sample satisfaction type surveys. So the first one I was mentioning is more around just like what are their needs and interests. And then under our evaluation benchmark, we do have some sample satisfaction surveys just around different programming. And again, I would say that's probably one where you want to pull different questions or tailor them to whatever your program is. All right, well, the last one I'll mention was just the October 3rd webinar. We're going to be talking about effective communication strategies for your total worker health programming. I think that one should be quite interesting, and we have our communication gurus here in our office giving that talk, so I'm looking forward to that. The link here will also take you to our listserv, so if you aren't following us on social media or getting our newsletter, I highly recommend. That's where you can find our latest information, different resources, all of the sort. So click on that. And I think, just a few more next steps. If you aren't recognized as a healthy business, but you're looking to do that, definitely either go straight to our website if you feel ready to go, healththingscertified.org, or you can contact David Shapiro. He's our business relations lead, and he will be able to assist you and answer any questions that you may have around that. If you're a business or an organization under 500 employees, I highly recommend joining our Small Safe Well study that the Center for Health, Work, and Environment is conducting. And this uses health links as an intervention, as well as some other components that are really cool, like an employee culture survey and total worker health leadership training to assess what's happening in Colorado small businesses. And lastly, if you're super passionate like I am about health and safety of the employee workforce, become a Health Links ambassador. Help us spread the word about, keeping our employees healthier, safer, and happier. And you can just click that link and it'll take you to a small application and just kind of tell me about yourself, and you can join our team. I don't see any other questions that have come through. If you do have them, my contact info will be on the email that goes out after this webinar is completed, and you can reach out at any point. Again, we will share all the materials from this today, and thanks for joining.
Somebody raised their hand.
Oh, how do you raise your hand?
I have no idea.
I do see that. So I do see the hand raised, Roberta, but I don't know if that means you have a question or not. If you do you mind chatting into the box? Oh, there's a different Q&A. Wow, Zoom's great, guys. Oh, yes, I see that you're saying the links don't work on the slides. When I send out a PDF version, I will double check and make sure that the links work. Thank you for flagging that. All right, well, enjoy the rest of your afternoon, and we will see you all next time for our webinars.
Thanks, everyone.
Thanks.